Distemper in dogs. Causes, symptoms, treatments and prevention. Distemper is very serious because it can be fatal. At any age, the dog can contract this very contagious viral disease, but it is in the puppy that the mortality rate is the highest because his body, still immature, is particularly fragile. The best prevention against distemper is vaccination. Let's take stock of this disease with virulent symptoms for which there is no specific treatment. Distemper. A viral cause. It was in 1905 that the French veterinarian Henri Carré, 1870–1938, discovered the etiology of this disease caused by a virus belonging to the Paramyxovirus group. Distemper, or disease of young dogs, is transmitted very easily from one dog to another, by close contact or by sneezing. This is the reason why it is even more frequent within a pack or in kennels. Although this pathology can be contracted at any time of the year, dogs, young or adult, are more frequently exposed to it between November and March because it is during these seasons that the disease develops the most. The virus enters the dog's body through the nasal and oral routes. From this moment, the maximum incubation period is 21 days, but it is from the 7th day that the animal becomes contagious. Distemper. What are the symptoms? The symptoms of distemper are extremely numerous. This does not facilitate its diagnosis, at least in the early stages, because its first manifestations are the same as for many other pathologies, namely, a body temperature of 40 degrees Celsius, asthenia of the dog, a lack of appetite that can go as far as anorexia. Then the disease does not take long to gain momentum. Carried by the blood, it ends up affecting different organs, especially in dogs whose immune system is not able to fight. When the animal suffers from the acute form of distemper, the symptoms of all kinds are simultaneous. They manifest themselves as digestive. Diarrhea and vomiting are frequent. Cutaneous. The horny layer of the nose and pads thickens. Hyperkeratosis. The epidermis is covered with red spots, then vesicles which evolve into pustules. Ocular. Discharge from the eyes. Inflamed conjunctivae. Neurological. The animal can be seriously affected to the point of going blind or even having convulsions because distemper also affects the brain. Respiratory. The dog has a significant runny nose, suffers from rhinitis, breathing difficulties or dyspnea and may even be a victim of pneumonia. To confirm the diagnosis of distemper, it is essential to search for the genetic code of the virus responsible through a PCR, polymerase chain reaction, or, in French, an ACP, amplification and chain par polymerase. This analysis is carried out on samples of blood, cerebrospinal fluid, stool, urine, various mucus and other discharges. A blood sample alone, while useful for testing for antibodies, cannot reliably identify distemper in dogs. Distemper. Is there a treatment? Today, it is possible to treat the symptoms of this highly contagious pathology, but there is no treatment for distemper. This is why it is unfortunately still very frequently fatal in fragile canids, and more specifically in puppies. Palliative care. The care protocol involves hospitalization of the dog and is essentially based on palliative care such as treatment of infections caused by the virus responsible for distemper, refeeding and rehydration of the dog by infusion. At the same time, to soothe a number of symptoms, the veterinarian prescribes an anticonvulsant, a treatment with antibiotics, an antidiarrheal or even an antiemetic as needed. Possible complications. Despite treatment for distemper, 1 out of 2 dogs recovers, but the majority retain serious neurological sequelae for life. Prevent distemper with vaccination. Distemper has been listed as a red Hibitory vice since 1989. To effectively prevent this extremely serious and highly contagious viral disease, it is essential to have your dog vaccinated. Vaccination against Carré's disease requires first of all a primary vaccination carried out in the 8-week-old puppy, then a second injection 4 weeks later. Thereafter, reminders must be made regularly. Do not hesitate to seek advice from your veterinarian. Distemper requires extensive, long-term care. It is a pathology which obviously entails great expense for the master of the animal. A good part of the costs incurred can fortunately be reimbursed by an animal health mutual. In the same way, vaccines and other acts of prevention are covered. It is strongly recommended to take out a contract according to the needs of the dog and the budget of the master after having compared the animal insurance rates through an online comparator.